Good afternoon, everyone. I am doing my presentation from home. Brian, you can go to the next slide. What you'll see here is that COVID has gotten real for me. I am now on quarantine. I do not have COVID, but I have a child with COVID. And so I'll be working from home for the next couple of weeks, a little less than 2 weeks now. I will tell you that I am not a person who likes working from home. Home for me has always been my haven. I did have a job once where I worked from home and I managed okay, but my house is not particularly set up for my comfort for working from home. My husband works from home a lot. Well, he set it up that way. Anyhow, so I am perched on a little bench in my living room and hopefully you could see me okay and hear me okay, and we'll all get through this. All right, so, and by the way, my son is doing very well. He had a little bit of a fever, some aches and pains and fatigue right off the bat. That's why we got him tested. He also, quite frankly, doesn't really follow the rules. More on that later. But now he's fine. He hasn't had a fever for a few days and feeling pretty good. So now the challenge is to keep him in isolation for the required 10 days. Remember, if you test positive for COVID, you have to be in isolation for 10 days from the time you develop symptoms. And 3 days without a fever. If that 3 days without a fever happens within the 10 days, the 10 days is as long as you have to isolate. But if you don't resolve your fever without medication for 3 days prior to the 10 days, then you add those 3 days on. So if you keep a fever, you could be in isolation for quite a while. So we're crossing our fingers, hoping that he stays without a fever so that the 10 days is up for him. Now, because I was exposed to him, I'm going to have to be quarantined for 14 days from the date of that last exposure. I will confess I got him out of my house, so my exposure to him is done. But I have to stay quarantined just in case I develop symptoms in that 14-day period. Most people develop symptoms within 5 days or so. But they have that 14-day window to be extra ultra conservative. So I'll be working from home until that 14-day window is up for me. Okay, next slide, Brian. So what's happening in the world? Well, COVID is here. We now have over 12 million cases in the world and 551,000 deaths almost. In the United States, that's the next slide, Brian. We have over 3 million cases now, almost 3.1 million, and almost 133,000 deaths. A lot of continued COVID, continued deaths. And I'm sure, just like we discussed last week, if you read the news or pay attention to what's happening, you might have seen it on social media. We have lots of states who are seeing a surge in COVID cases. There's discussion, is this still the first wave, the second wave? This would really be considered the first wave. A second wave is when you've already appeared to have resolved it, which we really did not. We didn't meet that criteria. So this is still part of the first wave. In California, this is the next slide, Brian. We've seen our COVID cases go up to about 290,000 and over 6,500 deaths. On the right hand of the slide, you can see that last week we had 222,000 cases and 5,980 deaths. Those increases from 1 week to the next actually are almost equal to what it was over a 2-week period last time I reported out. So we are seeing an increase in positive test results. We talked about that a little bit last week, that yes, we are testing more, and I'll talk about that in a minute, but we're also seeing a higher number of positive test results. So the surge in COVID is not solely a result of our knowledge of people having COVID because we're doing more testing. It's more people have COVID. So that's an important distinction. Next slide, Brian. In Fresno County, what this translates to is we're now up to 7,281 positive cases and 84 deaths. That's an increase of over 2,200 cases since last week and 11 deaths. Again, a very similar circumstance where what you're seeing is increases equivalent to about a 2-week period. And the next slide, this will show you our testing trends. And basically, you'll see the far left, I believe, is the very first or middle of March, and the far right is up through this last week, through the end of June. And you'll see that the number of overall tests has increased significantly, but the number of positive, that's the percentage of positive is the blue section, is going up. And so that is going up. Next slide. Our hospitalizations are also going up. So on this slide, you can see that as of today, and I think this is actually through yesterday, we have 172 individuals in hospitals in Fresno County that have confirmed COVID, and 40 of those individuals are in an ICU bed. And that compares to last week where we had 129 hospitalized, an increase of 43, and we had 33 in the ICU, which is an increase of 7. We still, however, have the same amount of ICU beds available, which is 74. And what that tells you is there's fewer people in ICUs that are not COVID than there was last week. And we would kind of expect this because hospitals are pushing hard to get people out of the hospital who don't have COVID to create capacity that they might need if we continue to see this increase in hospitalizations. The next slide will show you the most recent mortality review, and I'm sharing this with you primarily to tell you that we are still seeing people with no known comorbidities, although I do have to say that some of the data that you'll see on the Fresno County website is incomplete. And the reason it's incomplete is that we've had such a surge in cases that we've gotten behind on contact tracing and what's called medical investigation. So for instance, when my son tested positive, they call and they ask him a number of questions over time. And once we come off isolation and quarantine, they'll ask whether he's ever been hospitalized. They'll ask questions about his ethnicity, his age, all the things that fall into these reports that are produced. And if we don't have enough people doing that, we're now maybe like 1,200 cases behind. It's very difficult to have updated, accurate data. So a real focus in public health over the next couple of weeks is going to be free up resources to do this contact tracing and medical investigation, so we have a really good idea of the accuracy of this information, which can help guide our guidance that is given to the public, as well as our understanding of COVID. The next slide will show you the information from where we are on the watch list. And remember, we talked about what gets counties on the watch list. We've had a number of counties added to the watch list over the last week. It was 19 last week. I think it's up to 27 or 8 now this week. And when you're on the watch list, it's because you're seeing increases in cases and deaths and or increases in the positivity rate. And so what we typically see is if we're seeing an increase in positivity rate, which we are seeing, we would expect hospitalizations to go up over the next few weeks after that increase in positivity, and then deaths to go up after that. So we'll actually talk in a minute. The deaths across the state and in Fresno are going down a little bit, but that's only because those deaths reflect what the positivity rate was a few weeks ago or even a month ago. And so the deaths will follow, unfortunately. And so since the report last week, the deaths over 14 days has decreased. We had 17 deaths over 14 days that were reported out last week, And remember, it's a rolling 14-day average, and this week it's 13. But the number tested over 14 days has increased, and our positivity has increased. So last week we reported out that our positivity was 9.1%, and this week, over the last 14 days, of every single person who was tested, it went up to 11.3%. We need that positivity rate to go below 8%. And the reason we need it is a couple of reasons. The practical side of it is that if the positivity rate gets below 8%, it's easier for us to get control of the virus and keep things at a manageable level. But the other thing is we're not going to get off the watch list. We're not going to get back to indoor dining and that type of thing until we get the virus under control. And right now, frankly, we do not have it under control. Hold on just a second. Next slide, Brian. Okay, so what are we doing? All the same things I reported on last week are what we're doing. We're only bringing people back to work on an as-needed basis, based on work need. We're doing everything we can to ensure staff safety. Installing of the plexiglass, installing of high efficiency air filtration in all county-owned buildings, and asking that of all the buildings that we're in. Maintaining 6-foot distance. I cannot emphasize this enough. The mask, remember, is your last resort if you can't maintain that distance. If you maintain the distance and you have a mask on, it's even better for you. And then, of course, washing your hands, etc. And so, we're going to get tougher and tougher on the masking, the distancing, the signage, the plexiglass, everything, to try and do our part to help keep this under control. We continue to look at telework. A reminder that telework is not a right, it's a privilege. We're working hard to figure out how we can ensure that the individuals who need the equipment to get through this time will have it. We have acquired quite a bit of newer laptop equipment that has all the bells and whistles that you need. And so we are going through a process now of making sure that everybody who needs a county-issued laptop at home in order to do your job has it. We're also setting some aside and making them available so that if people do develop symptoms or need to work from home unexpectedly, who aren't already working from home, that we have some laptops that they're able to utilize. So we're really working hard to keep people employed, keep people able to work, and abide by these guidelines. And so to that end, and Brian, you can go to the next slide. What do we need you to do? What can you do? Stay home if you're sick. I really, really can't emphasize this enough. If you feel funny, you feel off, if you just don't feel right, or you have been exposed to a COVID positive individual or symptomatic individual, and that means you have a household member that meets that criteria, who you're living with in your home, or you've been less than 6 feet for more than 15 minutes without masks, then you're going to be stuck at home. Don't do that. Stay home if you're sick, and when you're out and about, stay 6 feet from people and wear your mask. I can't emphasize this enough. The health of our community depends on it. The economic health of our community depends on it. And I'm looking to all of you, not just to do it yourself, because I think you're responsible and I think you will, but to spread that word. Somehow, some way, we have to get it across to people that if we're going to live with COVID, we have to do these things. It does not benefit anyone for you to come to work when you're sick and infect everyone. It puts everyone at risk. So stay home. We do, to support you in that, remember there is 14 days off of time off allowed for COVID sickness. We need you to trust that the team will manage without you. I know some of you probably are reluctant to take time off because you don't want to burden other people, but we're going to make it through, right? We're going to get through this. We've done a tremendous amount of work. to get where we're at, to support one another. And we want to support you to stay healthy and well. We want to support you to be able to follow the guidelines. So you need to trust us on that. And if you have any questions, consult your supervisor or our human resource team. They can help you understand what leave options you might have and what are the return to work requirements. So again, that's what you can do. That's what we need you to do to get through this. This is a real deal, and we all have to take it seriously. Okay, I'm looking on the chat. We're to the point. Brian, you can go to the next slide where we're going to ask questions. So do we have any questions? I see that people are on here. Oh, okay, I see one. We get reports on people testing positive, but none on people recovering. Does this not affect the real data on who in the community is sick? So if we go back, and Brian, I'm going to tell you which slide it is. If you go back to the slide number 6, what you'll see there is total cases 7,281, active cases 5,668, recovered 1,529. And then the deceased and the hospitalized. The hospitalized on this slide is actually people who were ever hospitalized. Doesn't necessarily indicate current hospitalization. That was a different slide that I showed you. So on this one, the recovered lags, and the reason it lags is because we have a shortage of contact tracers and medical investigations going on. So there are people who probably, you know, in the beginning when we had fewer cases and we could keep track of that, it was easier to see that number go up. But particularly because we have a surge right now and we've struggled to get our contact tracing done, this isn't necessarily an accurate number. There's probably far more people in the community who have recovered than here. The things to look at is, what is the most recent positive test? If someone has a positive test, to your question, that means they're sick. So if we've had, over the past 2 weeks, over 2,200 people test positive, for sure those 2,200 people represent people that we know are infectious or have a positive COVID. And so that's the thing that we're watching. We also know that because everybody in the community isn't being tested, likely we do have people who are asymptomatic with COVID, or perhaps people who had symptoms and just chose not to get tested and stayed home. Hopefully they stayed home. And so the numbers are the best we have, but you will expect that number to rise over time. It just takes a little longer. Yeah, and then someone else reported out that we do have on the site recovered cases. What other questions do we have? I really do want to emphasize, and I mentioned earlier with my kid, you know, this is a kid who had 2 or 3 different masks, and I cannot tell you with certainty when he was outside of my site that he wore those masks. I have other children that I know they would have. And I know for sure that he went to parties and things where there were lots of people and probably no social distancing. And so that's the kind of thing that we really need to focus on and really need to make sure as much as possible that when we find out about stuff like that, we get people isolated, we get people quarantined. And so that's what we're doing now. But this is happening across the community, and this is why we're seeing an increase in cases, frankly. Okay. Someone asked me a question. How did my son get it? No idea. Really no idea at this point. There's no one else in our household who's tested positive or had any symptoms whatsoever. Like I said, I think he's done more socializing than he should have. I'm just going to be honest with you. And I think there's a lot of individuals in our community in that situation, that they are younger and they don't necessarily see the risks that all of us see, and are not always following the rules. And so I'm sure he got exposed in one of those, a community spread situation. All right. I personally don't have any symptoms, nor does anyone else in my household who might have been exposed to him. There's only 2 of us we think that were exposed to him because he hadn't been in the house for a few days. And so that's our situation, to be honest with you. Probably a little more information than I should share, but you know, that's kind of how I am. Any other questions that we have? All right, well, this was a quick one, only 20 minutes. If you have any questions when we get offline, please feel free to contact me. I will say that we're working on some other cultural humility activities. I don't want to leave that dangling out there. There's still a lot of focus, and I want to make the commitment as our department and the role that we play in the community, not just with the people we serve and those of you who work in the department, but for our community at large, that the cultural humility work that needs to be done in our department and our community is vast. And it's work that we have to be methodical, that we have to be intentional about, and we have to be persistent. And so that work is ongoing and will continue. Do not be afraid to remind me that that is our obligation. Do not be afraid to remind me that that is a role we play. And it's a ball we cannot drop. We're going to have to carry it like a little bit, you know, something that we're taking care of is our responsibility to this cultural work that needs to get done. And so I do want to make that commitment. You should expect over the next several weeks that we will have some additional opportunities for you to learn more. I want to emphasize as well, we're acquiring some resources, that a resource library where we'll make those resources available for people to check out. We really want each of you to be personally responsible for educating yourself about your role and your responsibility in the work that needs to be done in our community and our department. And so you should look forward to getting more information about that as we move forward. We've done a fair amount of work, foundational work over the last several years, but that work needs to continue and be expanded upon. So it's my commitment to all of you that we will be doing that. And I don't see any other questions. So with that, we'll close today's session, and I'll be back next week. So be safe, take care of yourself and your family.